Dentists are saying the extra appointments announced by the government to begin in April will still leave many patients missing out on care they desperately need.
The appointments will be targeted at so-called dental deserts, areas where patients struggle to find a dentist. Now, NHS England estimates that there are currently 2.2 million people who need urgent treatment but can't get a dental appointment through the National Health Service.
Government has pledged to deliver 700,000 extra appointments. But the British Dental Association says this will only cover a third of people who need urgent care.
Let's talk to Paul Woodhouse, who's from the British Dental Association. Good morning to you.
Morning.
You are going back to work today after
I am,
being here. Tell me about what you are seeing in terms of NHS patients, waiting lists, people who are needing help.
So I think my reception team will bat off at least 20 phone calls a day from people desperate to find an NHS dentist. It's people want routine care, people want urgent care. There is a massive unmet need.
So you, at your practice, you just cannot take any more people on?
No, we're full to the gunnels. In fact, we're probably oversubscribed for patients.
And that cannot change for your practice?
No, you can, as an NHS dental practice, you're given a fixed pot of money every year to spend on the NHS. Once that pot is gone, you can't do any more NHS work, so you've got to massage your funding to provide a year's worth of care for your patient cohort.
So where do these people go?
Who the hell knows? We see people turning up at A&E with toothaches. We see people, the same people we sometimes refer to as, sadly, frequent flyers who can only get urgent appointments. So most practices will reserve a slot or two every day where someone in real need can get in. We've got a few patients who end up just ringing us ad hoc every 2-3 months with another dental problem.
And what is urgent? What do you see when you see them in
It could be anything. Usually we would classify it urgent as something where there's an infection or a swelling, something that's going to compromise general health. A fractured central incisor, it's not the best looking thing in the world, but it's not going to cause you too much damage in the short term. But you get some people presenting who are on the border of sepsis.
I mean, that sort of thing really focuses the mind about the impact not getting an appointment has. Can you sort of tell us a little more about some of the things you've seen from people who have not seen a dentist for some time? Yeah,
we've had 3 cases of sepsis in the last year in my practice. My 12 o'clock patient, quarter to 12 patient, is just out of hospital after a bout of sepsis. We're reviewing him with a plan to see how we can rehabilitate his mouth.
And just for the people who don't understand, the sepsis, because that's been caused by, what, an infection?
Yeah, absolutely. We hadn't seen him for a couple of years. He was a regular patient, hadn't been in for a while. One of his teeth had gone bad, got an infection that had spread under the floor of his mouth and was compromising his airway. So I managed to get his tooth out as an immediate measure, shipped him straight off to the local maxillofacial surgery unit. They admitted him to intensive care, surgical drains.
Well, I suppose in a way, you said he was on your books. So in a way, that's a slightly different problem, isn't it? Someone who could be going to the dentist who chooses not to.
He hadn't attended to us in 2 years.
Right.
And, you know, if that's someone who hasn't been in for just a couple of years, imagine a patient who hasn't been in for 5 years, 10 years. Some patients we see haven't seen a dentist for a decade plus. And sometimes they walk through the door and they're absolutely fine and there's nothing wrong. And sometimes it's like a battlefield and there are multiple problems that need fixing.
So this money that has been announced, 700,000 extra dental appointments, right, promised by the government. And what the BDA has found is that, or taken a look at the numbers and said, well, actually, that only covers a third of what's needed.
Yeah.
In your view, what will happen to those 2/3?
Well, I mean, first off, it's not new money. It's not extra money. It's just the dental budget being reallocated from somewhere else. So where there's underspends, it's been moved into areas of greater need. The 2/3 who aren't getting seen still need to be seen. And that's just urgent care we're talking about. There's still routine care, things like periodontal disease, gum disease. It's a long-term problem that needs to be addressed on a routine basis, which will lead to tooth loss and dental disability. But it's not really an urgent problem because it's kind of a slow burn chronic problem. There's millions of people out there who need that addressing as well.
I'm sure your next client client, patient? What do you say?
I say patient. There's a big debate about that, but I treat people.
Your next patient, 10 o'clock appointment?
10 o'clock, yeah.
You've got to get there, so we'll make sure you're on time. Nice to see you here this morning. Thank you very much.
Thank you.
Thanks very much.
That's Paul Woodhouse, dentist and spokesperson for the BDA, the British Dental Association.
It's coming up to 7 o'clock. We will be back with the headlines at 7. In the meantime, find out what's happening with news, travel and weather wherever you are today.